Welcome, everyone. Good afternoon. My name's Dr. Bob Van Son with Penn State Veterinary Extension, and I'd like to welcome you to our Dairy XNet webinar. I'm going to go ahead and get started right away. It's my great pleasure to announce one of my colleagues who will be giving our topic today on lameness. He calls this lameness from the inside out and the outside in. I think we'll be quite thrilled with the information that Ernest is getting ready to give to us today. Our speaker is Dr. Ernest Hovingh. He's currently an extension veterinarian and field service investigator here at Penn State University. Prior to his time with us, Ernest was on faculty at Virginia Tech at the veterinary school and completed his veterinary degrees up in the North Country in Canada, and has expertise in epidemiology and deals on a number of infectious diseases important to dairy cattle, namely Johne's disease. He's our coordinator here in Pennsylvania, and also, of course, on lameness and some of these problems. So I'm going to move right ahead. Ernest's got a lot for us to cover, so Ernest, take it away.
All right, thank you, Dr. Van Son. I will just share my screen here so we can see my PowerPoint, and we'll get started. As Dr. Van Son said, I do have a lot of information to present today. We're going to try and get through much of it as we can here in a hurry. But if you have any questions, please make sure that you ask those. And we'll just make sure I get the right screen here. Are you seeing the PowerPoint currently or not? So we're just trying to... Okay. I'm assuming you're seeing my PowerPoint now. And what I'd like to do is really cover a lot of material on lameness. It's going to be a general overview of lameness. And then we normally do this as part of an on-farm workshop as well, where we'd include a hands-on component, doing some trimming and so on. But we're just going to try and cover some of the material today. And as I said, if you have any questions, please feel free to ask, because I'm certain to omit some stuff. What I'd like to do is really consider lameness, looking at it from what happens inside the foot, what are some of the conditions that predispose an animal to becoming lame, and then also what are some of the things that happen on the outside of that foot that are more likely to make an animal lame. And hopefully we'll see how those interact, and that will give us some ideas as to how we can prevent lameness on farms. Now, I'm assuming that I don't have to try to convince too many of you that lameness is a pretty significant problem. It's obviously a fairly costly problem. I don't have time to get into all the research that looks at this. But it affects everything from reproduction to milk loss and culling. Those animals are much more likely to get culled. The treatment costs are usually a fairly small component of the overall cost of lameness. And it's also a condition or a disease that's very frustrating for a lot of producers to deal with, just because it's not a fun one. A cow that's not pregnant doesn't really cause a lot of problems as such, but a lame cow is a nuisance to deal with a lot of the time. So it's a very frustrating problem. I think there's another cost that we sometimes don't think about, but that we do need to think about, and that's the animal welfare cost. It's obviously a concern if we have animals that are being neglected, such as these Jersey cows here at a sales barn that I was at, obviously not receiving the care that they should be getting. It happens too frequently that we go to a herd and find a cow like this. I think Lisa's going to try and put up a video here, but you've probably seen these. So this is obviously a concern when we have animals showing up on the farm that are severely lame. This is a locomotion score 5 cow. She's walking around, not even touching that foot to the ground when she's walking, in severe pain. She's not going to get better overnight, and this certainly didn't happen overnight. So we need to do something with animals like this. It's a humane concern. It's an animal welfare concern that we need to deal with. see if we can get back here now to all right. So we also have this Neil Anderson from the Ontario Ministry of Agriculture and Food in Ontario, Canada, called it a contract with the cows, if you will. We have an ethical or moral obligation to make sure that we provide for them housing, safety, food, and comfort in exchange for what we get from them, the milk and the meat that we get from them. So I think that's something that Neil Anderson brings home quite well. We certainly don't need to be talking about the level of animal rights, but just making sure that we're treating animals appropriately. And Bernie Rollin at Colorado State University has remarked on a number of occasions when I've heard him speak and when I've spoken to him that it's interesting how a lot of the departments which used to be called animal husbandry at our universities have been replaced by departments of animal science. And that means we've probably done a very good job at developing the science aspect of our animals, of our agricultural animals, and we've done a very good job with that. But he wonders out loud if we have neglected some of the animal husbandry side of things in exchange for being very good at the science. And I think there might be some truth to that in some situations, that we need to make sure we don't neglect that at the expense of the science. Well, if that's not enough to convince you that it's an important topic, the folks who buy your products are concerned as well. This is just from a recent look at McDonald's website. You can go to any of the major restaurants and food manufacturing industry websites and see similar type of stuff. They're concerned about the humane treatment of animals. They want to make sure that their suppliers, and ultimately, obviously, that comes from the farm, that they're instituting appropriate husbandry practices. And so they want to make sure animals are free from cruelty, abuse, and neglect. And that's something that we've already seen in the egg-laying industry, somewhat in the swine industry, and you can be sure that they're also monitoring the situation on the dairy side of things. Well, if that still isn't enough, we also have these groups that are out there campaigning against animal agriculture, and especially what they would maybe entitle factory farming, as hard as that is to define. And so the Humane Society and PETA try to use obvious animal abuse cases as a hook to get people interested in their cause. And oftentimes, those end up being situations where we have cows that are lame, cows that are very thin, cows that are lame, cows that are down. And so this is one that was not too long ago here in Pennsylvania. And again, a common thing that you see is animals that are down, and again, a lot of those will be related to lameness. So I think that's another thing that we have to try to make sure we do, is make sure that we deal with these issues so that they don't have an opportunity to try and convince the public that this is the way all of the animals are treated out on our dairy farms. So we know that isn't true, but we need to try and minimize the opportunity for those types of things to happen. So, as I said, we could have gone on a lot longer talking about whether or not lameness is important. In short, I think it is. It's an expensive thing on the farm because of the economic impact that it has. It's certainly a frustration and a nuisance to deal with. We have an ethical and moral obligation to deal with lameness and try and minimize the pain that it causes. And then obviously the people who are buying products from dairy farms also have a concern. So, all right, well, I'd like to suggest that if we're going to deal with lameness, we take a structured approach to that, and that we do that using this approach here, the PIM approach. The first component, we need to prevent lame cows. That should be something I think every dairyman wakes up thinking about in the morning and goes to sleep thinking about at night. We want to then identify any lame cows that might have, where we might not have prevented the lameness. We want to try and make sure we identify those as quickly as possible. And then we want to make sure we have a system in place to manage or treat those lame cows so that we return them to health as quickly as possible as well. So we're going to go through these in order. We're going to look primarily at preventing. We'll touch briefly on identifying and managing lame cows, but in the time frame that I have, we don't have time to get into a lot of the details. Of course, if we're going to try and prevent lameness, it would certainly be helpful to know what causes lameness, why lameness develops. That will help us try and target our prevention in the right areas, at the right problems. And for those of you who are out on farms a lot, if you're not a dairy farmer, I'm sure that you know that most of the lameness that we see in dairy cattle occurs in the feet. So while there certainly is some interesting stuff that happens higher up in the leg, we're really not going to spend any time on that today, just in the interest of time, and also the fact that claw lameness is by far and away the most common problem in our dairy cows. So what I'd like to do then is again, use this inside-out and outside-in approach. We're going to look first at the internal factors that affect hoof health, and then at the external factors. And really, these fit together, and they play off each other, so that if certain things on the inside are not working properly, they can be more easily impacted by external factors, and so on. All right, here's a kind of a schematic that is not maybe complete, but it certainly tries to give you some idea of how these things interact. We get called out to a fair number of farms to try and investigate lameness problems, try and figure out why they have an increased level of lameness in their herd, and it's very seldom one single thing that we can go out to that farm and find the problem and say, this is the only problem on this farm, this is the only thing that's causing lameness. It's usually some combination of these factors on the farm. So what are some of the main ones I want to talk about today? Well, we'll very briefly touch on genetics. We'll spend a fair bit of time talking about this laminitis. I have that in quotation marks, and you'll see why. And then two that really go together is this loss of cushioning and excessive pressure on the corium. Those two factors really work together, and they also are impacted a lot by external factors. Well, as Dr. Van Son would tell you, I am not a geneticist. I don't even want to be one. I don't play one on TV. And I can get into trouble if I talk too much about it. So this is about all that I'm going to put up. Basically, there is enough evidence out there to say that there are factors, genetic factors, that affect lameness. That we should be thinking about that. We can think about that in our breeding programs. But obviously, by the time we're presented with a cow in front of us that is lame, it's a little bit too late for that cow. So it is something that you should consider in a breeding program, and that's really all that I wanted to say at this point about that. This term laminitis, this condition called laminitis, is something I would like to spend a bit more time on, though, because I think that's pretty important. And as I'll show you, we deal with a lot of cadaver feet that we get from the slaughterhouse, and we see lots and lots of evidence of laminitis inside those, as well as on the outside of those feet. So I'd like to look at what is the lamina, and the lamina is part of the corium. So what is the corium? What is laminitis? And perhaps a better term would be, what is coritis? And then what does it matter? How does that show up? What are the problems that you might see on the farm, that cow walking around on the farm? Excuse me. Just a quick look at the anatomy of the foot, just to make sure that we're all on the same page here. You can see the dashed line in the picture on the left. If my cursor is showing up, you'll see me kind of going around that. That's called the white line. Okay, it's usually actually a little bit darker. It's not white, but it's called the white line, and that's where the sole joins the hoof wall. Okay, so the white line is where the sole joins the hoof wall. In this picture on the left, I've outlined the approximate area where the P3 bone would be underneath that sole. You obviously can't see it in that picture, but if we go to the picture on the right, again, I've outlined the P3 bone there. That's the last bone in the skeleton of that cow. Above it would be the P2 bone, not outlined in that picture. And you can see that there is a space between that P3 bone and the hoof wall, and between the P3 bone here and the sole down on the bottom of that foot. So that space, which you see here also as empty space now in this skeletal section here. The P3 bone sitting inside the claw capsule. This is the actual bone that came from this claw capsule. So you can see there's a fair bit of space in between here that would normally be filled with tissue, and a very important tissue at that. If we take that P3 bone out of that claw capsule, you'll notice a couple of things. First of all, you see these lines or ridges in here, which we'll talk about in a few minutes. You'll also notice on this P3 bone, the shape of that P3 bone, I've rotated it slightly, but at the back here is where our flexor tendon attaches to this P3 bone. And that right there is that point on the back of P3 right here, which, as for those of you who trim feet, would recognize as a pretty common place to see sole ulcers. All right, well, the tissue that fills that space between the claw capsule and the P3 bone, a very important part of that tissue is the corium. There's other things in there as well, but the corium is the actual tissue that produces that claw capsule. So what you see on the outside is produced by the corium. And this is a specimen, cadaver specimen that's had the claw capsule taken off of it, and you can see the corium here. You'll see the corium is also on the sole, although you can't see it. And as you can appreciate just by looking at it grossly like this, there's different regions of that corium. So we have the area where the white line is produced right here, and we have the area where the hoof wall is produced up here, and the coronary band and heel is produced by the corium here, and then obviously the sole, the corium on the sole produces the sole. Well, that special area of the corium right here is the laminar corium. So technically this is the lamina. This is a sensitive lamina because that hurts if you poke it. This is the insensitive lamina. It's on the claw capsule or the bone. And as you can see, these two layers fit together like a hand-in-glove type of situation. And I've got a picture here, photomicrograph from Christoph Muehling that shows nicely how those two layers of the lamina interdigitate and layer together like that. Now, actually, between these layers, there's a Velcro-like tissue in between here or component that really holds those two layers together. It does allow some movement there, but it holds those two layers together. And it's really important that that tissue is very healthy so that these layers do hold tightly together. We'll see the consequences if they don't do that. So technically then, laminitis is an inflammation of the lamina. Okay, but really, so that's really just this area here. But really, that inflammation or irritation and injury can happen anywhere in that corium. And so technically, a better term would be coritis rather than using the word laminitis, because as you'll see, it'll show up in different ways depending what part of the foot is affected. And certainly the corium up here can be affected. The corium on the sole can be affected as well. So I'll use the terms interchangeably, but coritis is probably a better term from a technical point of view. All right, so when we have inflammation or irritation or injury in that corium, anywhere in that corium, that's going to alter the blood flow. Similar to if you bang your knee or your elbow and end up with a bruise, you get injury somewhere, you end up with a change in the blood flow to that area. But what you might ask is, well, what causes that inflammation or that irritation or injury in the very first place? And that's a great question because that's extremely important. So there's a number of things that can do that. Rumen-acidosis is certainly one of the potential factors that can be involved. Toxic mastitis or metritis are factors that can be involved, and mechanical injury is also very important. So we'll look at the mechanical injury aspect a little bit later. Just to go into a quick sideline here, or side note about rumen-acidosis. We don't have time to get into a lot of detail, but very quickly what happens is that the pH in the rumen, if it drops significantly, the ecology of the rumen is affected. Some of the bacteria and other organisms in the rumen can't handle that change in pH, and they end up dying because of that drop in pH. And as those bacteria die, they actually release compounds that can have an effect on the circulation of the cow. Now, those bacteria don't necessarily have to come from the rumen. Okay, so if a cow has mastitis caused by specific bacteria, they can also release these vasoactive substances. Similarly, if a cow has toxic arthritis, an infection in the uterus, she can also release these vasoactive substances when those bacteria die. Rumen acidosis is something that tends to affect larger groups of animals, and that's why it tends to be a more important problem. Toxic mastitis will affect one cow in a group. Rumen acidosis will affect a larger proportion of that group. And so what happens is these vasoactive substances are then absorbed either from the uterus or from the udder or from the rumen, and when they get into the circulatory system, they can affect the blood flow in different parts of the cow. What we're interested in today is how they affect the blood flow in the foot. Okay, so they can cause some changes in the blood flow, and they can actually restrict some of the blood flow down in that foot. Okay, so that's one way that rumen acidosis then will affect the blood flow in the corium, and as I said, there are other things that can also affect that blood flow. So if we have a part of this corium that is now not receiving adequate blood flow, it means that it isn't getting enough oxygen, it isn't getting enough nutrients. If the damage is severe enough, as in mechanical injury, it might actually cause the death of some of the cells in the corium, but it's also certainly possible that the cells in the corium just don't have enough oxygen and nutrients to do the job that they need to do. So the corium, if we're not providing it with the correct nutrition, then it stops producing clot tissue for a day or two or three, or maybe it does its job, but it doesn't do a very good job, and it makes poor quality clot tissue because, again, it's not as healthy as it should be. If you think about this, similar to what we tell our kids, you have to eat appropriately, you have to eat meals that are healthy, that keep you happy and active, and really we could just put 3-a-day fuels corium in here too, which would be a similar type of approach. So we have to make sure we keep that corium healthy, and that we get the proper nutrition so that it can make good quality clot tissue for that cow to walk around on. Well, that's important because if that cow does not have healthy quality feet, or good quality feet, healthy feet, then we end up with damaged corium leading to poor quality or defective clot tissue. If you put feet such as the one on the right here into an environment that is going to be much more susceptible to other damage because now we have poor quality or defective sole tissue. In this case, this is an underrun sole, and here we have heel warts. Again, this is an infectious disease, but certainly there is some evidence to suggest that there might be some other components to it as well. And so again, if we have poor quality heel tissue in this foot, there's certainly the potential that it's more susceptible to becoming infected. Let's look very quickly at some of the different areas of the foot and what you would see on the outside. So if we have problems in this part of the corium, in the sensitive lamina, what happens? Well, what happens in that case is that those layers of lamina don't hold tightly together. So we end up with separation of the sensitive and insensitive lamina. That shows up as white line separation or white line disease, and it can also affect how that P3 bone fits in that claw capsule, and it might ultimately result in pancake feet. What does white line disease look like? Well, here's a cross-section. If you're sitting in front of your computer, this toe would be hitting you in the nose right now. It's a cross-section through the claw, and you can see the P3 bone right here. The laminar corium is right here. The lamina or the laminar corium is right here. The outside hoof wall is here. And you can see right in this area here, okay, that we have some problems that are going to show up in the white line eventually. Okay. The corium here the corium that was right here, did not do a good job making white line tissue right here. You can see it's abnormal. It looks like there's blood trapped in there, and that's going to be weaker than it should be. Okay, so as this grows out, what you might see is white line separation such as this. Now again, there's certainly potential that the mechanical factors, the way this cow turns, the flooring that she's walking on will also affect this, but if you have a very, very healthy white line, it's not too likely that it's going to separate. As the white line widens and separates, the bacteria can enter into this, and they can cause infection of the lamina, so they can work their way up, and then that infection breaks out often up at the coronary band. Here's a cow that was in one of the herds that we were doing one of our workshops at. We just happened to catch this picture. You can see some pus here at the coronary band. That infection actually came in from the white line down here. 99.99% of those do. They travel up the inside of the hoof wall, and then break out at the coronary band. So that infection didn't start here, started down at the bottom of that foot. If we had a very healthy white line, much less likely that this would have occurred. Well, this is the insensitive lamina, the little drawing here, a pencil drawing. The insensitive lamina and the sensitive lamina, the P3 bone is in blue. If these two layers do not hold tightly together, then we end up with the potential that as this cow puts weight on that P3 bone, that hoof wall can move outward to some degree. It's not held tightly to that bone, and so it has the ability now to start moving away, splaying out to the side. And also, as we lose some of that holding capacity in those lamina, we end up with increased pressure on the corium of the sole. Right? So we have less weight transferred through the hoof wall. Now on the cow, there's normally a bunch of weight going through that corium on the sole anyways. Horses tend to have much less than cattle do, but still, as this occurs, we end up with more pressure on the sole, and that's not good for the corium on the sole. Well, if that white line separation becomes significant and if that damage is permanent in the lamina, then we end up with a situation like this foot here. The claw on the right is pretty much normal. Certainly there are some changes on the outside of that claw. The claw on the left is obviously abnormal. In this situation, this is a permanent condition now in this cow, and so we've got separation of that white line. It's pulled apart, extremely wide because those lamina are just not holding together. You can trim this so it looks half decent and the cow can walk on it all right, but it is a permanent condition and you're required to trim that frequently. We take a foot like this and flip it over and have a look at the bottom. You'll see on the left, the white line is fairly normal. That's approximately the width of that white line right there. But if we look on the right side here, you'll see that the white line is separated and this whole area is now the white line. So that, in fact, if you look just above where those arrows are, you can see what looks like the layers of the insensitive lamina right here, that we have permanent chronic separation of that white line. All right, well, if that cow goes out and walks around in the environment, this is very likely to happen. Okay, that she breaks off that hoof wall just because it's so wide and it's not well attached. This would be somewhat analogous to you taking your fingernail, ripping your fingernail off, and then walking around on maybe ripping a toenail off and then walking around on your toes, and then dipping it in copper sulfate or formaldehyde a couple of times a day. You can appreciate that be a very painful condition. There's certainly potential for an infection developing up along that hoof wall as well. And this cow was from the slaughterhouse, and I expect that this is one of the reasons that she ended up being culled from the herd. All right, so that's problems in the lamina. What happens if we have problems up in the hoof wall here? Well, the hoof wall growth then will either slow down or stop, and we end up with what we call a hardship groove. This is what a hardship groove looks like. So this actually started up here. Okay, it's like your fingernail. It'll start here and then grow down this way, and so it grows at approximately a 1/4 inch per month. So we could actually go back and calculate approximately when something happened to this animal. If you want to do this at home, I can give you a second to make your own hardship groove. It'll take a little while to form, but I've done it for you since I am such a dedicated extension educator. Take a hammer and hit your thumb, and you'll see here, as you see on my thumbnail, a very nice hardship groove. Obviously, my corium underneath here stopped making thumbnail for a while because it had so much damage to it, and that's similar to what you're seeing here. A little bit more dramatic on my thumb. You can also see damage to my corium here underneath my thumbnail, the blood that's trapped underneath there. Now, sometimes in cattle it can get this severe, and here's a case where we have what we call a thimble toe. The hoof wall basically stopped growing for a day or two, way back up here. But now, as this toe grows out, you can see the potential for it to break off is very real. This might not cause any problems, but again, there is the potential that we expose the corium underneath here, either to infection or just that it's a very painful condition for that cow for a period of time. All right, what happens if we have problems up here in the coronary band and the heel area? Well, typically with a coronary band, we probably don't see a whole lot of problems, maybe some flakiness to the coronary band, but it's pretty common to see heel horn erosion. and that looks like this. Okay, so if we see heel horn that looks like this, or like this, that's, again, evidence that maybe we didn't have very healthy heel horn formed by this cow. Now, there's certainly environmental factors that play a role. Okay, if we take healthy feet and dip them in manure 2 or 3 or 4 times a day, or force cows to walk in an environment like this, they can probably handle that a little bit better, though, than a cow that has made very poor quality heel tissue. She's more susceptible to heel horn erosion. So again, you see how the external factors and the internal factors play together to determine whether or not a cow becomes lame. Again, I could take a cow that has fairly weak quality or poor quality heel horn. If I put her in an excellent environment where everything's clean and dry, she's not nearly as likely to develop heel horn erosion. All right, well, a very important part of this foot is the sole. And so we'd like to have a look for a minute what happens if the corium down in the sole either produces poor quality sole tissue or stops producing sole tissue. And we can see a number of different things, from the very simplest or the least likely to affect the animal, just basic discoloration of the foot, some blood trapped in there, or some serum, to poor quality sole tissue that's soft or chalky, and I'll show you pictures of each of these, to a situation where we actually have that corium in the sole, taking a day or 2 off and not producing any corium, or producing any sole tissue, and all of these might show up. Just again to remind you that the corium is right here. It forms the sole, and then it pushes it down as it makes a new layer of sole tissue. So what you're seeing at the bottom of that foot was actually formed weeks and up to a couple of months ago as it grows down. So what you're seeing on these feet here, these are routine trims. These are not lame cows. You're seeing blood trapped or serum trapped in these feet. You'll see some here. This is actually in the white line, but you can see some here, and in these where all these yellow arrows are. That's blood or serum trapped in the sole tissue. Doesn't mean the cow is going to become lame, but that's not normal tissue, and it's weaker than the tissue that doesn't have that discoloration there. So there's certainly evidence that this animal might be more susceptible to developing lameness. Well, for those of you who have done any trimming and have run into this soft, chalky sole tissue, you know that stinks. And it's also evidence that that corium did not make normal tissue for a period of a day or 2 or 3, however long it was. So that's, again, evidence of abnormal tissue, abnormal corium, not happy corium that made that sole tissue. The problem with this, again, more susceptible to mechanical injury, more susceptible to becoming infected, and so on. Well, here's another cross-section of a claw. The toe is down to the left, lower left of your screen. Don't have all the toe on there. P3 bone, you can see the bottom of that P3 bone right here. Comes around the back like this. Sole down here. The corium is right here, which produces that sole. And you can see evidence right back here at the back of P3 that something has happened in this cow. You've got what looks like a bruise there. Okay, if we zoom in and have a closer look at that, this is a bruise right here in the corium. Big trauma to that corium. Could have been rumen acidosis that was also part of this. I don't know exactly what happened with this cow. But you can see there's evidence, there's separation here between the corium and the sole. Okay, in a healthy foot, in a normal foot, there should be no separation there at all. Those two should be firmly attached because that corium is producing sole tissue all the time. So as this grows down, if the corium here starts producing new sole tissue again, you're going to end up with a defect in this foot as it grows down. Here's another one, just to demonstrate a similar point. You can see kind of a fat pad here under the bottom of P3 that extends to the back. The corium is right here, and this whole area indicated in red, with the red arrow here, is all the sole, and this is the youngest sole tissue right here being formed by the corium now. But you can see it's not homogeneous. There's obviously something going on there that's not normal. We've got fairly normal looking sole tissue here, and then right here, we've got something that looks not quite right. So again, we'll just zoom in on the same picture, and again, the fat pad here, the corium right here, all of this is the sole tissue, and right here you can see evidence that there's something going on here. Okay. And if you look at it, I've taken a little toothpick here, I can actually separate the sole, there's a dead space in the sole or a defective layer in the sole right here, okay? And that extends quite an extent in this animal from all the way here at the back of P3 all the way to the front third of P3. So as this grows out, that's going to be susceptible to becoming infected, ending up with an abscess. We might end up just with a double sole, anything like that. Here's another one. We were doing a workshop with hoof trimmers, and this is a claw that I cut in half, so you can see I've split it here. This is the outside half of the claw. This is the inside half of the claw. And if you look here, you can see, again, bruising over the back of P3, and you can see really along this whole area here, there's a layer of abnormal sole tissue. It extends all the way there, and in fact, you can't see it on this picture, but it extended further towards the toe as well. So as this grows out, we're going to have the potential for that whole sole to become separated there, underrun sole. Sometimes they're called heel fractures if they extend all the way to the back, and we can pull that whole sole off of there because we have a defective layer in that sole. All right, so this is what it looks like on the outside when you see that when you're trimming. So when I see this, again, I think laminitis in this cow a while ago. When I see this, there's manure packed. This is one layer of the sole. This is the new layer of the sole here, and there's, again, a bunch of manure packed in there. This has already been trimmed away. But again, that's double sole. And again, to me, that's evidence of laminitis in that cow a number of months ago, 4, 6, 8 weeks ago, something like that. Well, if that layer becomes infected, and we have bacteria trapped in there, so this area right here, for example, becomes infected, then we end up with an abscess. Okay, we have an abscess in there. If we have a healthy sole, we really shouldn't get that abscess spreading throughout that sole tissue. Okay? It's only in situations where we have defective sole tissue like this that abscess can really spread and become a large abscess. So if I see an abscess, again, I think that there was probably an underlying cause there that we had some laminitis previously. All right, well, let's go back to this picture here where we had this problem at the back of P3. This can be a problem if we end up with very severe trauma here or repeated episodes of trauma and problems in the corium. Then we can end up with a situation like this where we end up with what we call a sole ulcer. Okay, so this is the back of P3. This is the inside of the claw up here. This is the back of P3. And you can't see it really clearly here, but this is actually a sole ulcer. And what a sole ulcer is when we have a defect all the way through this sole, all the way to the corium. Okay, so if I look at some pictures of that, here's one on the left. You can't see it quite as well, but this is going to be all the way through here, through the sole. This one here, if you were in front of me, I'd ask you what that was, but that's the corium. Okay, so you can actually see the corium right here. And obviously this corium has to be healthy enough, and we have to make sure we leave it healthy enough that it can make new sole tissue to cover over this defect. And so the way we treat that corium, we have to treat it with respect, and we have to treat it tenderly because that corium has to cover up that hole again in order to make that foot healthy. So sole ulcer is not quite as bad as it gets, though. It can be worse. This is a situation where we now have a sole ulcer. This is, you can't really see very well, but P3 comes right about to here. This is the back of P3. Now we have bacteria entering that ulcer. And when they do, they get into that joint space. They get into the joint space right here. They travel up the tendons up here, and we end up with a septic arthritis. So this is a cow, that we saw on that farm. I'll pretty well guarantee you that this cow had a septic arthritis. You can actually see this claw right here. Looks a little bit swollen. And this isn't going to get better no matter how much of whatever magic drug you want to give her. It's going to require some more dramatic intervention. Another cow from the slaughterhouse. Again, this did not happen overnight. You can see the evidence that P2 bone has been eaten away here. This P2, P3 joint space is completely grown together. And again, this should not have gone on this long. It's not appropriate to leave that animal for that period of time before sending her to slaughter. All right, so that gives you hopefully some idea as to how laminitis can affect the foot, or coritis can cause problems in different parts of the foot. And this chronic laminitis, so that we have low-level laminitis, ongoing laminitis, is a pretty common problem. and it can be one of the things that can be underlying a lot of lameness conditions in our dairy cows. There's certainly other factors involved as well. Let's have a really quick look at a couple of those. Sorry, let me go back here. This is a fellow researcher from Cornell looking at the fat pad, or the digital cushion as it's called. And here is where the digital cushion is, right there. Here's a schematic of what that looks like. That offers some shock absorbent effect to the corium, so that we're not compressing that corium and causing a lack of blood flow because of the pressure between the P3 bone and the sole. Now, it is also known that that fat pad will disappear. You take a heifer after she freshens and you ultrasound her, you'd find that fairly quickly that fat pad will start to disappear. And certainly as we lose some of that shock absorbing capacity, the potential for damage to the corium is also very real. Another thing that was kind of interesting, some research done looking at putting cows on a treadmill and looking at the way they put their feet down. This is the left rear foot of this cow. She's walking kind of towards you. And as you can see in this picture, the way they put their foot down is they actually end up putting in the hind limb, this is the left hind limb, the lateral claw hits the floor before the inside claw. So it's going to take more of the force, more of the weight, more of the impact of that cow than the medial claw. So again, another factor that's probably involved in this. And then again, especially if we have unhealthy sole tissue, it's going to be more susceptible to damage because it does take more of the weight, and it appears to be the first area of contact when a cow is walking. Another thing that happens as the cow's around calving, we end up with hormones circulating in that cow that help relax tendons and the ligaments, which is pretty important to get that calf out of there. Unfortunately, it appears these also have some effect on the tendons and ligaments down in the foot. And so again, a schematic here that kind of shows some of these tendons and ligaments that will offer some support to that P3 bone. As they soften up a little bit, that P3 bone can move back and forth just a little bit more like this, okay, and potentially rock back and forth a little bit more like this. And that could be why in this cow we see some damage here with pinching of the corium if that P3 moves more in that claw capsule than it normally would. Well, we can also just end up with direct trauma to the corium. This is more similar to the hammer on the thumbnail approach. As you can see here, if these animals are walking through an area like this, picking up stones and so on, ending up with stones on the bottom of their feet, they're going to end up with potential for bruising, okay? The bruise on the bottom of the foot, and again, that's going to be a weakened part of that of the coria, of the sole now, and the potential for further damage is very real. So as we have pressure on this foot, that can be because we have a decrease in the fat pad, but it can also be because we're forcing this cow to stand on her feet longer than she should be. It can be because we are giving her not a very flat surface to stand on, and so we're putting weight in very pointed areas of that foot, or we're getting point loading on that foot. And so we end up then with decreased blood flow through that corium. So some of it has to do with the shape of P3 in the sole. And this is where we really start to interact now with how we trim that cow, so what that foot looks like, where that cow lives, how easily she can lie down, what the flooring is like that she's walking on, and so on. So I've only got a few minutes left here. We're going to fly through this quickly, but what we're thinking of now is really how do these things affect the ability of that cow to make healthy quality sole tissue. So cow comfort is important because we need that cow to lie down enough during the day so that she takes the weight off the corium, okay, and then allows the blood flow through that corium to be optimal for nutrition of the corium. So we don't have time to get into all these details, but obviously we want a stall that a cow can get into, and not only that she can get into, but that she wants to lie down in. So that's pretty important. Again, we don't have time to get into the research, but there are ways that we can affect whether or not a cow wants to lie down in the stall. Stall design can be part of that. The amount of bedding in the stall, how dry the stall is. There's a number of different factors that researchers have looked at and have found to be significant in terms of predicting or affecting the ability of that cow to lie down in the stall. Obviously, we're forcing our cows to do things. They can't just live their lives the way they want to. And so what we see here is that sometimes we put cows in headlocks. We leave them in headlocks for a long time. A lot of weight on the corium. We're not allowing them to take the weight off. Milking 3 times a day becomes more important. We're locking these cows in a very small environment, forcing them to stand for a long period of time. And so there's ways that we can affect the health of the feet by the way that we handle these animals, by the amount of time that we force them to stand during the day. We really need to try and minimize that time, give them time to lie down. Heat stress is also important. If we're getting into lameness situations now, in November, December, that's often related to heat stress. And I know most of you will say, well, it's not very warm in November, December. But remember that rumen occurred back in August, September, and it takes a while for that to show up because we have defective quality soil tissue formed, and then it shows up a few months later with our problems. So we really need to be thinking about things like shades and fans, using water to try and cool those cows down so that we try and reduce the amount of rumen, and then hopefully 2 months down the road, we will see less lameness than if we hadn't implemented those heat stress management strategies. Condition of walking surfaces are also pretty important. This is up in the upper left here. You'll see where the floor was grooved. And you'll see that we have some grooving in the floor here. That's worn away over the years, and this herd actually had a lot of bruising in the soles because they ended up with a very small weight-bearing area because of all this concrete that was worn away here. Dan McFarland sent me this picture down in the lower picture that's covering the whole width of the screen. This is actually a very rough surface, a brand new newly poured floor, and this would cause tremendous wearing on the soles of these cows, and I can guarantee you we'd have a lot of lame cows. There's also a lot of potential for bruising and trauma because of the stones that were left here. So again, we can certainly affect lameness by the walking surface. Well, we've already talked about hygiene a little bit, so I don't want to spend much time on that. But obviously trying to keep these cows as clean as possible is pretty important. Obviously important for milk quality and other issues as well, but it's also important for feet. So again, heel erosions are one of the big things. Interdigital dermatitis, other things on the skin of the feet can certainly be affected by those feet being dirty. Foot baths, we'll just touch on that very quickly. This picture I got from Jan Shearer on the left. We can say something good about that foot bath. It's nice and deep, and the cows are forced to go through it. Other than that, it certainly looks to me like there's a lot of floating things in there. There's probably a lot of manure in there. The one on the right was a herd in Virginia, and very clean feet going into the foot bath, very clean solution, and again, a nice depth on that foot bath solution as well. So you can guess which one of these probably works better. If you have dirty feet and or a dirty foot bath, I can pretty well guarantee you that you're going to have limited success. Conversely, if you're going to end up with clean feet and a clean foot bath, it doesn't matter a whole lot what you put in there. You're much more likely to be successful with that combination. So there's not one magic thing that you have to put in a foot bath, but really clean feet and clean foot bath solution is going to go a long ways to being successful. So that's why for me to sit here and tell you that there's one optimal foot bath solution and one optimal schedule for every farm is not appropriate. Some farms need to be foot bathing every single day, and other farms, even very large farms, can get away with doing it once a week or so. All right, I know I'm going to run out of time, so we're just going to talk about trimming for 2 seconds here. With trimming, what we want to try and do is distribute the weight evenly across the bottom of that foot. We want to try and minimize pressure in any one part of the corium. And so what we're trying to do is take the weight off of the white line area here, and the sole, the hoof wall, and try and distribute it across the whole bottom of the foot. So here's a cow that was actually on her way to the foot trimming table, the hoof trimming table. You can see all the weight is in the white line and the hoof wall and the heels. Okay, and if we use this functional claw trimming method, which is a method that's been fairly widely adopted, but not always implemented correctly. If we use that, what we're going to try and end up with, and we'll just show you a quick video of here of a local hoof trimmer doing that. Just see if we get that up here. I think, are you seeing the video there now? So that should be, that's showing up on your computer. We've got the trimming going on there, okay? And so this guy is using the functional claw trimming. He's trying to make that as flat as he can, front to back and side to side, taking very little off that heel that he's working on right now. That's the outside claw that he's working on right there, and he's taking more off of the outside claw, and you can see he does a very nice job, again, making it as flat as possible from front to back and side to side. What we're trying to do with that is trying to maximize the weight-bearing area. So as we increase the surface area on that foot, we will have less pressure on the corium. Let me go back to sharing mine here. So this is what we should end up with when we are done. We want a foot that is flat front to back and flat side to side, and that again is going to decrease the pressure in that corium, because now this is again that same herd that we saw previously, a cow going back from the hoof trimming table. You can see that she's got a lot more weight bearing area and therefore decreased pressure on that corium. All right. Very quickly, let me just hit a couple of things here. Ideally, I'd like to check all normal cows at least twice per lactation, or lactation cycle, I guess. You can check my dry off as well. Don't trim every single cow. They don't all need trimming. Some of them just need very little touch-up on that foot. And if you routinely see cows becoming lame 3 to 7 days after you trim them, or 10 days after you trim them, it's maybe time to have a talk with the trimmer. Occasionally that happens. Everybody gets the cow a little bit too thin, or some cows certainly have problems and they might become lame. But if this is a routine problem, then it's time to have a chat with the trimmer and see if they're making those toes too short or the soles too thin. All right, Dr. Van Zon's going to kick me off here in a second. So we really got through the prevent part. The identify part, all that I'm going to say with this is you've got to make sure you identify some of these cows, because this is your opportunity to make some money. Those 4s and 5s, the cows that are limping severely, they're no fun to work on, and a lot of those don't end up doing very well. But if we look at this locomotion scoring, there is a way that we can prioritize these animals and try and make sure that we focus on some of these cows in this group here, the 3s, maybe the 2s, and to try and make some money on those and prevent them from becoming these 4s and these 5s. If you're just trimming these 4s and 5s all the time, the very lame ones, that's not a whole lot of fun and doesn't get you very far. Then lastly, the only thing I want to say here is I want to encourage you to trim those cows as soon as possible. If you've got a 4 and a 5, don't wait till the hoof trimmer gets there. Make sure you have somebody on the farm who knows how to trim that cow, knows what to do with her until the hoof trimmer or the vet gets there, and deals with her properly. So there's certainly research to show that if that locomotion score 3 cow is much more likely to become a clinically lame cow than a locomotion score 1 or 2 cow. Okay, so if you can intervene in this 3 cow, you've got a chance to prevent more significant problems down the road. All right. So hopefully we can prevent, if we treat this ulcer and we treat it appropriately, we can prevent the septic arthritis. Hopefully if we treat this cow before she becomes an ulcer, we can even prevent that. There's some cows that should not be treated, except maybe by euthanizing them or taking more drastic actions such as amputating the claw. That's something you should work with your veterinarian to do, not something that you probably should be doing on your own. And again, make sure you know when to make this call. Make it sooner rather than later. I've already indicated that I think every farm should have one person trained how to do this at least. Know how to put a block on. Okay, that's one of the simplest things you can do, and I think one of the best things you can do for a lot of these cows. Put a block on, even if you have to wait a week or two till the hoof trimmer gets there. Know how to put it on. Know which claw to put it on, and that'll I think save you and the cow a lot of pain. All right. So again, think about lameness in this structure. Prevent them, identify them, and then manage them. And hopefully that will make for a less lameness in your herd and happier cows. So Dr. Van Son, if we have time, I guess we have time for a question or two.
Yeah, thank you. Wow. Lots of information to think about. Jenny had a question. Ernest asked about elaborating a little bit more on the link between heel erosion or laminitis and heel warts?
Right. So that's a good question. I think it's fairly undisputable that heel erosions, a significant factor in heel erosions is the hygiene of those animals. So I'm not trying to downplay that at all. The dirtier those feet are, the more likely, and wet, if they're dirty and wet, the more likely you are to end up with heel horn erosions. There is some research to suggest that if you have cows with acidosis, some coritis, that maybe if that heel tissue is not as healthy as it should be, that it's more susceptible to erosions, and maybe that cow is more susceptible to heel warts as well. It's not a really clear link, but there is some evidence to at least suggest that. And I think if you think about it, it makes sense. If that cow produces heel tissue that's inferior quality, it's more likely to end up being affected by a dirty environment. So I can take a cow that has extremely healthy feet and put her in a dirty environment, and she can probably withstand that better than a cow that has suboptimal quality heel tissue. So that's kind of the link there between those two. Certainly interaction between the external factors and the internal factors, with the external factors being very important.
All right, looks like our time is up. Ernest, thank you so much for the great information on lameness, and thanks for everybody for participating in our webinar, and hope to see you back here again in another month.
Thank you.